The time for conversation is over. We need action.
On the heels of Canada's premier's meeting in Victoria, BC's family doctors are fed up with all the endless talk. Talk about what changes need to be made. Talk about pushing Ottawa to fork over more cash for healthcare, but lack of movement to make changes to fix a failing system.
There's no question that we do need more investment in healthcare, and more funds from the federal government, of course, would be welcome. But there are absolutely things that we could be doing now and that we must do now that will address the primary care crisis that we have in this province.
That includes trimming administration costs, giving family practices assistance with overhead costs, and changing fee codes to pay family doctors for the work they are doing.
There is money there, and a lot of the allocation is the problem.
The pandemic, they say, has shown what's possible. The province came up quickly with fee codes for telehealth, for talking with patients about COVID vaccine, and more recently, the time it takes to get patients the COVID treatment Paxlovid.
That is showing a lot of family doctors, and we're like, hang on, it's not as hard as they've been telling us for the last decade or so. And I think that's what's fueling a lot of the unrest with us, because we know it is possible.
Further frustrating the family doctors is the province's hyper-focus on urgent primary care centres, which Dr. Lush says have been a patent failure at attaching patients to ongoing care and even leading some family practices to throw in the towel.
It would be wise to invest funds that we currently have into longitudinal family doctors who will care for patients the way they need to be cared for, rather than investing it in administration and in expensive experimental models such as the urgent primary care centers, which is what historically has been done by the current government.
They say it's getting harder and harder to justify the financial pressure and long hours of keeping a family practice going when they could go work at a hospital or telehealth, increasing their wages and cutting their stress substantially.
Longitudinal family medicine is the poorest compensated field in medicine, and yet it's one of the most important. It's one of the most cost-effective fields of medicine. It keeps people out of the emergency rooms and reduces hospitalization costs.
The Canadian Medical Health Association and Canada's nursing unions, who met with the premiers in Victoria, were hoping provincial leaders would leave, having set tangible short and long-term goals to revamp healthcare, but ultimately that didn't happen.
Nobody wants to just abandon our patients, and so it's hanging on by the goodwill of the family physicians, but that is running really, really short.
In Victoria, Liza Yuzda, City News.